Cefoperazone, Cefobid uses, dosage instructions, and side effects.
Cefoperazone is a third-generation cephalosporin antibiotic, cefoperazone class, given as an injection or with sulbactam.
It's used to treat serious infections like pneumonia, urinary tract infections, and intra-abdominal sepsis. Its rapid, broad-spectrum action and resistance to many beta-lactamases make it highly effective. What is cefoperazone? Cefoperazone is a semisynthetic broad-spectrum cephalosporin effective against pseudomonas infections.
Cephalosporins are third-generation antibiotic agents that treat various bacterial infections caused by susceptible organisms in the body. The bacterial infections include respiratory tract infections, skin infections, endometritis, bacterial septicemia. What are the benefits and uses of cefoperazone? Cefoperazone is a powerful antibiotic used to treat a variety of bacterial infections throughout the body. Its broad-spectrum activity makes it valuable for both community-acquired and hospital-acquired infections. Conditions cefoperazone treats. Cefoperazone effectively treats numerous bacterial infections, including
respiratory tract infections, upper and lower,
skin and soft tissue infections,
urinary tract infections, bone and joint infections, bacterial septicemia, intra-abdominal infections, endometritis and pelvic inflammatory disease, peritonitis, meningitis. Secondary uses of cefoperazone.
Beyond its primary indications, cefoperazone is also used for
Escherichia coli infections, Haemophilus infections, Pseudomonas infections, Proteus infections, surgical prophylaxis in certain procedures, febrile neutropenia,
mixed aerobic and anaerobic infections, especially when combined with sulbactam.
How does cefoperazone work? Cefoperazone works by interfering with bacterial cell wall synthesis.
Like other beta-lactam antibiotics, it binds to specific penicillin-binding proteins, PBPs, located inside the bacterial cell wall. Specifically, cefoperazone prevents the cross-linking of peptidoglycan chains, which are essential components of bacterial cell walls. This interference weakens the cell wall structure, causing bacterial cells to become unstable and eventually rupture due to osmotic pressure, resulting in bacterial death. This mechanism makes cefoperazone bactericidal, killing bacteria, rather than bacteriostatic, preventing bacterial growth. The addition of sulbactam and cefoperazone sulbactam formulations enhances its effectiveness by inhibiting beta-lactamase enzymes that some bacteria produce to resist beta-lactam antibiotics.
Cefoperazone dosage.
Cefoperazone dosage depends on the severity of infection, the patient's condition, and the specific bacteria causing the infection.
It is typically administered as an intramuscular or intravenous injection. Typical dosage instructions. For adults,
general infections, 2 to 4 g daily, administered in equally divided doses every 12 hours. Severe infections, up to 6 to 8 g daily, divided into equal doses every 12 hours. Extremely severe infections, up to 12 to 16 g daily in divided doses has been reported without complications.
For specific conditions, endometritis, 1 to 2 g for every 12 hours, continued for 48 hours until clinical improvement. Febrile neutropenia, 1 to 2 g for every 12 hours for 14 days. Joint infections, 1 to 2 g for every 12 hours for 3 to 4 weeks. Pelvic inflammatory disease, 1 to 2 g for every 12 hours for 48 hours until improvement.
Pneumonia, 1 to 2 g for every 12 hours for 7 to 21 days depending on the causative organisms.
What should I do if I miss a dose?
Missing 1 or 2 doses of cefoperazone typically has minimal impact on treatment effectiveness. However, for optimal results, try to maintain a consistent dosing schedule. If you miss a dose, take it as soon as you remember, unless it's almost time for your next dose. In that case, skip the missed dose and continue with your regular schedule. Never double up on doses to make up for a missed one.
What happens if an overdose occurs?
Overdose of cefoperazone can lead to medical emergencies and harmful effects on bodily functions.
Symptoms may include seizures, neuromuscular hyperexcitability, encephalopathy,
severe gastrointestinal symptoms.
If an overdose is suspected, seek immediate medical attention.
Treatment is typically supportive, focusing on managing symptoms and may include hemodialysis in severe cases.
What are the side effects of cefoperazone? Like all medications, cefoperazone can cause side effects.
Most are mild to moderate, but some can be serious and require medical attention.
Cefoperazone side effects. Common side effects includes anemia, GI bleeding, hemolytic anemia, leukopenia, bone marrow, depression, bleeding, dizziness, anorexia, dyspnea, abdominal pain, skin rashes. Serious side effects: hypersensitivity, hematology, hepatic, gastrointestinal, blood and lymphatic system disorders, immune system disorders, hepatobiliary disorders, skin tissue disorders, vascular disorders. Precautions while taking cefoperazone. Several precautions should be considered before and during treatment with cefoperazone.
Who should avoid this medicine? Individuals with known hypersensitivity to cephalosporin antibiotics.
Those with severe allergic reactions to penicillins or other beta-lactam antibiotics.
Patients with a history of cephalosporin-associated hemolytic anemia.
Conditions where caution is needed: kidney disease, renal impairment, liver disease, hepatic impairment,
history of gastrointestinal disease, especially colitis, bleeding disorders or conditions that increase bleeding risk,
malnutrition or poor nutritional status, alcoholism,
people with serious health conditions. Pregnant women. The use of this medication during pregnancy hasn't been thoroughly studied, but it doesn't pose a significant risk of pregnancy loss or birth defects. However, it's advisable to consult your doctor before taking the medication to ensure safety. Breastfeeding. This medication passes into breast milk and can cause side effects in children who are breastfed. These can include diarrhea, vomiting, and rash.
Before taking it while breastfeeding, consult your doctor. Are there any age restrictions for using cefoperazone?
While cefoperazone has been used in pediatric patients, its safety and effectiveness in children have not been fully established.
The half-life of cefoperazone in serum is 6 to 10 hours in low birth weight neonates, which may require dosage adjustments. Alcohol or food interactions.
Cefoperazone contains an N-methylthiotetrazole (NMTT) side chain that can cause a disulfiram-like reaction when alcohol is consumed. Patients should avoid alcohol for at least 72 hours after receiving cefoperazone to prevent this reaction, which can include flushing, sweating, headache, and tachycardia. Possible interactions with other medications. Cefoperazone may interact with several other medications, potentially affecting their effectiveness or increasing the risk of side effects.
Drug interactions.
Anticoagulants, e.g., warfarin. Cefoperazone may increase the anticoagulant effect, increasing bleeding risk.
Probenecid may increase cefoperazone levels in the blood. Aminoglycosides, potential for increased nephrotoxicity when used together. Diuretics may increase the risk of kidney problems. Oral contraceptives. Cefoperazone may reduce contraceptive effectiveness. Disulfiram may enhance disulfiram-like reactions. Vitamin K antagonists, increased risk of bleeding. Supplement and herbal interactions. Always inform your healthcare provider about any supplements or herbal products you're taking, as they may interact with cefoperazone.
Some supplements that affect blood clotting, like ginkgo biloba, garlic, or fish oil, may increase bleeding risk when combined with cefoperazone.
How should cefoperazone be stored? Proper storage of cefoperazone is essential to maintain its effectiveness and safety. Following the manufacturer's guidelines will help ensure the medication remains stable until use. Recommended storage temperature.
Cefoperazone should be stored at or below 25 degrees Celsius 77 degrees Fahrenheit and protected from light prior to reconstitution.
After reconstitution, protection from light is not necessary.
Refrigeration of reconstituted solutions, 2 to 8 degrees Celsius, can extend shelf life for up to 5 days.
What happens if cefoperazone is not stored properly?
Improper storage can lead to degradation of the active ingredient, potentially reducing the medication's effectiveness or causing harmful byproducts to form. Signs of degradation may include color changes or visible particles in the solution.
Never use cefoperazone that shows signs of degradation or that has been stored improperly.
Always keep cefoperazone away from children, direct sunlight, and moisture. Store in the original container and discard any unused portion according to healthcare provider instructions or local regulations for medication disposal.